Hello viewers, I am Dr. Jasmeet Kaur Wadhwa, pulmonologist, allergist, sleep specialist. I am heading the Center of Asthma, Allergy, TB, Chest and Child Center. In this center, we are performing a pulmonary or a lung function test. So what is pulmonary and lung function test? PFT or the lung function test is the same way the way we do echo in patient having cardiac diseases. In patient having lung diseases, we perform a pulmonary function test. This is a very useful test, especially those patients and children who are suffering from repeated cough, cold, wheezing, breathing difficulty, chest discomfort, and fatigability. So with this test, we actually diagnose is the patient or the child is having asthma or not, or bronchitis symptoms or not, or COPD or not, or if they are basically what we diagnose in that is like this is a model of the lung. Generally, when we see the lung is having two components, the airways and the rest is the lung tissue. So mostly patients use the word pneumonia, but some many times the X-ray is normal. The way we focus, like the X-ray is normal. This is the X-ray of the patient. This is totally normal. We can't see much of patches in this. But many times these patients are having repeated breathing difficulty, chest discomfort, wheezing. They say, ma'am, X-ray to normal hai, but why we are having trouble? So this is the problem. What we face is that their airways are having the issues. These are the airways. They are having inflammation in these airways. The swelling is there in the airways. Because of this, they keep on having trouble of coughing, a chesty cough, what we say, a breathing difficulty, and they're not able to understand. They are using unnecessary antibiotics or anti-allergics by mouth or by tablets, but they are not getting relieved of the symptoms. So because of this, we perform a lung function test, means a function which checks the airways swelling and the inflammation. Now, according to the age, height, and weight of the patient, you can focus it over here in this graph. We have taken the name of the patient and the age of the patient. You can just focus on the graph here only, and the height of the patient. So first we measure the pulmonary function test. There are some values which come over, which is a pre-test, and then we give them a bronchodilator, and then we do the post-test. So there is some relevance of pre and a post-test. If there is some difference or change of reading above 11 or 12%, that means the patient is having something like a reversible disorder, which is maybe asthma and bronchitis, and it is totally cured by medication. And some patients have restrictive lung diseases in which it may be because of COPD, allergic bronchopulmonary aspergillosis, they are having some patches in the lung, then the difference of treatment is there. So this is a very good test. How is it performed? Just see this. Mostly there are the mouthpieces. These are disposable and sanitized mouthpieces, and these are the spirits which we use in our there is an apparatus over this in which we fit into it, and we tell the patient to blow. Now this is the way it fits, and we tell the patient to blow it very fast and very strong. The way you can just look what the way I'm doing it. Pehle, the patient should inhale and then put this into the mouth. This is the way they blow out. Means the first blow should be very harsh, like very sudden, and then it should go on and on till the time we tell them that no, you should do that. This is a forceful exhalation, because the problem of asthma or allergies or bronchitis are basically because of inflammation in the airways, and this inflammation in the airways has got problem in breathing out. So that is why we are seeing this graph in which their breathing out is there and how much flow is coming. So mostly the patient has a flow of more than 80% or 90% of their values. But if they have restrictive flows and the patient is having somewhere around 68 or 69%, that means it is the difference is there. So we give them a bronchodilator and repeat it. This is the way a pulmonary function test is done. So this is a very useful test. By blowing forcefully and exhalation, we come to know the problem of the respiratory. Mostly people think that it cannot be done below 6 years of age. This is a misnomer. With a specialized person under and a good software, even we can perform this test in 2 to 3 and 4 years of age. In that, we don't tell the child to move forcefully blow, but whatever he can do it. There are some incentive like you have to blow the balloon, you have to blow the candles and all that. Whatever way he is able to do, we measure the values, and then we give the bronchodilators with a spacer and a puff or whatever, or nebulizer, and then we repeat it again. So we see the difference in that. This is the way in children we measure FEV 0.5. So we even do this test between 2 to 4 years of the age, and even in the adults, and it is a very useful test to diagnose all this bronchitis, asthma, wheezing, and COPD. Thank you.